My name is Ioanna. I'm a mental health dietitian and I'm specializing in eating disorders. Currently, I'm working in a day service specializing in adults with eating disorders. So my job role entails to be able to create meal plans and just do sessions with patients to provide their full recovery from eating disorders. Day service is basically something between hospital wards and community. So it works as an artificial environment, like something between hospital wards and their lifestyle in general. So patients just come here Monday to Fridays. They recreate their lifestyle, like making their own meals here based on our support. And that during the day they can just do work or play board games with patients. Just try to refocus their whole mentality set of eating disorders. My role will be first to have an assessment with patients to be able to recognize what the individualized meal plan will be, and also run group sessions with the patients in order to provide psychoeducation like nutrition and healthy lifestyle, and also have review and meetings with other members of staff to create that approach for the patients. Communication is the priority skill in general working for the NHS in order to provide that education and key information to the patients, especially for mental health patients should be able to have that empathetic approach and just be actively listening to them. I was always wanted to be a mental health dietitian. Mental health is a taboo and also impacts our physical health. I did shadow with specialized dietitians on that job role in order for me to familiarize myself of how mental health dietitians actually work, and then also had the approach of eating disorders and the impact. Originally I come from Greece, so Greece is well known for like Mediterranean lifestyle. Unfortunately, a lot of people out there just suffer from like heart disease. That would impact my lifestyle as well. So one day we just visit as a family a dietitian, and then I just realized how that a meal plan and one approach from a staff member can impact your whole health lifestyle. So that actually just made me realize that I want to be a dietitian. So I studied online from the Queen Margaret University of Edinburgh. So I just finished my degree online and did my placements in hospital wards in Greece, but also just follow the criteria for the UK. And then I'll just finish my bachelor degree and then came to the UK to work for the NHS. Really straightforward application, so you either find the job role somewhere in the website for the trust or other health education jobs, and then you just able to provide your qualifications and your experience, and then you just come along with an interview and then either take the job or not. For me, it worked to shadow hospital wards and specialized staff members, so I think that's also a good tip for them to shadow like wherever they want a specialty, especially mental health. Just be able to familiarize themselves of what mental health dietitians can do and where they can find on hospital day services or community, and then just always be up to date with like scientific research.